Please do not submit detailing patient information other than about yourself, and ensure you adhere to the General Data Protection Regulation. Hi guys, welcome back to my YouTube channel. If you're seeing my face for the very first time, you're welcome. My name is Rashida and I create nursing content in the UK. A condition to starting a place on the MSc Nursing Pre-Registration Program is a submission of evidence of how your first degree and a prior experience relates to nursing. This evidence will demonstrate that you meet the standard of a nursing student who is completing a 3 year program. Usually, studying nursing in the UK lasts 3 years. However, a completion of your first degree and a relevant care experience within the last 5 years gives you a credit towards year one of studying nursing. But because this course is an accelerated program that lasts 2 years, you'll be required to complete a recognition of prior learning, which is the RPL. In my previous video about the requirements that is needed to come onto the MSc Pre-Registration Nursing Program, I mentioned about the RPL, which is the recognition of prior learning, but I thought that there's a need to do a detailed video on how to fill your recognition of prior learning, because I feel like recognition of prior learning, it can make or mar your application. So you need to be sure, especially when you have a school that you really want to go to, you need to be sure that you are dotting the I's and crossing the T's. So here is a detailed video on how to fill your recognition of prior learning for the MSc Registration Nursing Program. But because this course is an accelerated program, it lasts for 2 years. So you'll be required to complete an RPL. RPL simply means recognition of prior learning. It is the formal assessment and acknowledgement of your learning achievements that you have occurred in the past. And recognition of prior learning is a very important document that has to be taken into account before admitting students on the MSc Nursing Pre-Registration Program. So simply put, RPL is just a document you need to fill, and it includes a number of clinical proficiencies that you'll be assessed on in a care or hospital setting. Usually, there are 3 sections in the RPL. The first one I'll be talking about is the NMC Platforms, which is the Nursing and Midwifery Council. Here, you will be asked to give an academic writing or reflection on things like care coordination, working as part of a multidisciplinary team, promoting health, or factors that may lead to inequality in health outcomes. You may also be asked like situation questions, like tell us about an experience where you showed compassion to a patient. For each of these NMC platforms, you will be asked to provide a narrative about your knowledge and experience in regards to how you meet them. The next section I'm going to be talking about is the assessment of proficiencies. So proficiencies is like a list of knowledge, skills, and attributes that you must be able to demonstrate when caring for people across all ages in different care settings. So each of the proficiencies needs to be signed, verified, dated by a registered nurse. Example of proficiency will be something like ability to provide person-centered care to a patient. So there are quite a lot of proficiencies, but you just need to sign the one that is on your RPL. So there will be a lot. So just make sure you sign each one of them. It is dated and it is just make sure it is signed. The third section of the RPL will be the record of practice hours. So in order to start a master's in nursing pre-registration program, the Nursing and Midwifery Council requires you to have an equivalent practice hours to a student nurse at the end of their first year. Remember, you are only doing 2 years, year 2, year 3. So the number of practice hours, it needs to be equal to a student who has just finished their first year. This number of hours vary from school to school, but usually within the range of 500 to 800 hours. So while you are volunteering at a hospital to get experience, you need to also consider the amount of hours that you will need. At the end of the day, your RPL needs to be verified by a registered nurse in that hospital. The person will confirm the total number of hours that you have worked and activities that were carried out during that time. You will also be required to provide a reference with the RPL, because the school will still contact them personally to verify that you really did this amount of hours and you really did all the things that you've listed in your job description that you did in that hospital. So I hope I've been able to give you the detailed information you need regarding recognition of prior learning. Just make sure you can definitely do it. But here are my top RPL tips that will help you even more. So my first tip is give yourself enough time to complete the RPL portfolio. Most times, schools will usually give you within 3 to 4 weeks to complete the portfolio. Don't be in a rush. Don't be in a rush. Don't do your RPL within 1 week and say you want to quickly submit. No, it doesn't work that way. So far as they've given you a time frame, you can even submit on the last day of your time frame. Make sure you give yourself enough time because you want to make sure you do everything that is required of you. There's no need to rush. Take your time and finish up your RPL. My next tip is going to be make sure your portfolio reflects an academic approach at a level 7, which is a master's level. Don't write your RPL in such a way that don't write it in such a way that they'll feel like this person just finished secondary school or is still an undergraduate. Write critically. You can search online on how to write critically. Make sure you are writing critically. Make sure you are critiquing. So my second tip is make sure the evidence you are submitting is not more than 5 years. Your volunteer experience, make sure you've done it in the past 5 years. It shouldn't be more than 5 years. So, and if you are submitting any testimonial or care certificate or anything like that, make sure you've done it within the past 5 years. My next tip is going to be authenticity. Make sure your RPL is unique to you. These people, they like uniqueness. Make sure it is unique to you. You don't need to make sure you write it by yourself. Make sure it is unique to you. It is personal to you. You get what I'm saying? My next tip is going to be if you are asked to write a reflection, maybe a reflection of an incident or situation, try to write it using a reflection model. There are different types of reflection model. We have the Gibbs reflection model. We have the Atkins and Murphy. But I think Gibbs is highly known in the nursing industry. So you can use Gibbs reflection model. It's quite easy, and I personally recommend it as well. So you can use the Gibbs reflection model. So another tip is make sure you reference anything you are doing. If you are writing critically, make sure you reference and avoid plagiarism. Yes, avoid plagiarism. You are coming to the UK, avoid plagiarism. The next thing I'm going to talk about is supporting evidences. Make sure you submit everything that you know will help your application. I'm talking about things like your CV, the job description of all the things you were doing when you were volunteering in the hospital, and testimonials. While you are doing your volunteering, you can easily walk up to a nurse or any other healthcare profession. It doesn't even have to be a registered nurse. It might be an occupational therapist, a physiotherapist, a dentist, anyone that is within the healthcare industry that is in the hospital. Maybe you did some few hours with them or you worked with them for a day. You can tell them to write you a little testimonial about how you've been able to work with them. They'll write it for you. Just snap it and add it as part of your testimonials, okay? Another tip is to take free online courses. If you go on Udemy, Allison, Coursera, you will see some free online course. Care courses, it might be something as little as oral hygiene, mouth care of the eyes, just little things like that. It really helps a lot. So you can do all these courses. You can do the free ones. You don't have to do the paid ones. You can do all these courses and attach the certificates to your RPL as well. Lastly, do not submit detailing patient information other than yourself. Ensure you adhere to the General Data Protection Regulation. Please don't, because I've told you to attach supporting evidences, don't go and snap a patient care plan or a patient information and attach it as your evidence. It is very wrong. Please don't do that. Please, guys, don't do that. Make sure that all the information that you are putting out there, it doesn't have anybody's name. To talk about a patient, you don't have to mention the patient's name. You can say patient X, patient A, Mr. A, Mrs. B. So don't mention anybody's name in your recognition of prior learning, please, guys. After submission of your RPO, if there's an adjustment, if they tell you that there's something that they need to do, in some schools, your assigned supervisor will send you the RPL back and guide you on the things you need to do to pass the RPL. And the person will tell you that you need to submit it within a particular time frame. While in some schools, once you don't pass the RPL, the only thing that they are going to do is they will tell you that you cannot proceed further, but they'll give you a chance to apply for BSc nursing. And we don't want to apply for BSc nursing, isn't it? So that is why I said you need to take your time to write your RPO. Take your time. Make sure you do everything you need to do so you can get the admission. Guys, I hope this information helps you. I hope it's been really helpful. I hope that you are going to go ahead and write your portfolio without any issues. If you have any comments or any query, you can drop me a comment in the comment section. I usually reply, or you can send me a DM on Instagram. I'll definitely reply as well. So thanks guys, and see you in my next video. Bye.